Funding for the production of Public Square provided by the W.K. Kellogg Foundation, working to improve the lives of vulnerable children.
I was terrified that something would send us into debt for a medical emergency we couldn't handle.
There are 40,000 kids in New Mexico who should be on Medicaid and who are not on the program.
The process is so cumbersome. It's not for lack of trying on everyone's part to get those kids covered.
There's no way to handle it. There's just, you have to just file the bills away and you have to, prepare when there is a chance to pay.
Hard-working families like Lily and I have to jump through hoop after hoop after hoop to get basic care. And that's not getting anybody's family healthier or out of poverty.
Welcome to Public Square, where civic dialogue takes center stage.
To invest in early care and learning, investing in health, it's an investment that returns in a healthy, contributing citizen. It makes sense.
In New Mexico, at least 9% of children do not have health insurance. We all pay when children aren't covered. These kids are less likely to receive necessary medication and more likely to experience a hospital stay that could have been avoided by seeing a doctor earlier. And healthier kids lead to more productive, healthy adults. Ideally, this situation would improve under the National Affordable Health Care Act. There will be an expansion of the Medicaid program and a new health insurance exchange to help families purchase coverage. But will things get better? Today, we talk with families as well as community and health advocates about the challenges in getting kids access to care. We'll be joined by community leaders Representative James Roger Madalena, Senator Sue Wilson Beffert, and Rory Cobb, Director of Outreach for New Mexico Health Connections. Before we begin, here's some more information on our topic.
Actually, I leave the baby like that. Let me measure the baby's head.
So you want to put the baby over here?
Victor Prospero is 6 months old, and he's here at First Choice Clinic for his regular well baby exam. Victor was born prematurely, and the hospital staff at the neonatal intensive care unit helped his mom, Gina, get him signed up for Medicaid. That makes it easier for his parents to get all his regular checkups in this important first year.
Well, he's always had that breathing, like the wispy breathing. Since he was born and in the NICU, they decided that his airway was small. So then it took until his 4-month checkup, and the doctor finally heard him laugh and realized that there was something else going on. And if we wouldn't have had the well child checkups, we wouldn't have found out what was going on with him.
How are you?
Good.
Good. How's little Victor doing?
Doing good.
Good.
And how old is he now?
6 months.
6 months. All right. Well, I'm just going to...
The family is slated to see a specialist in October to get more information on Victor's condition. But their regular provider is Dr. Jennifer Garcia.
Children that come to us and have an issue, a medical issue that is an ongoing problem, the earlier we can pick up on the issue, the earlier we can evaluate it, and hopefully keep a close eye on it so it doesn't become a bigger problem. So for example, if a child has an abnormal hip exam when they're born, which is something we check at all the exams, then we can identify that early and send them to a specialist to see if they need any kind of bracing or harnesses to hopefully help them walk normally in the future. So something like that goes undetected for a few months can really impact a child for their whole life.
First Choice accepts all kinds of patients, those who have private insurance, those on Medicaid or Medicare, or people with no coverage.
What we do at the 6-month visit is he'll get his 3rd set of shots. So he'll be all up to date for that, and then we'll see him back when he's 9 months, and we'll just keep checking his growth and development. But he looks great so far.
There are not nearly enough clinics like this to meet the demand that exists now or that will exist in the next 6 months. There are 8 clinics in the First Choice system that are seeing patients in that manner. And even though we'll see over 300,000 visits a year, there's still just a tremendous need for additional primary care, whether it's pediatrics, family practice, or adult internal medicine.
First Choice also helps eligible people enroll in programs like Medicaid. It's easier to get needy children, like Victor, on Medicaid than to enroll adults in the program. But even if kids qualify for Medicaid coverage, they're less likely to be enrolled if their parents are uninsured. Health providers hope that will change with the Affordable Care Act. It means some 400,000 uninsured people in New Mexico will be eligible for Medicaid or for health plans on a state exchange. But advocates worry there will not be enough outreach to get people enrolled. That, they argue, would leave families and children more vulnerable.
If you're not accessing health services, not getting vaccinated, not having preventative care or health promotion reviewed with you and your family, then all of the kind of endemic problems that we're seeing now, childhood obesity and childhood illnesses, which are all preventable, are much more likely to occur.
For Gina Prospero and her fiancé, having Medicaid coverage helps them give their kids regular care that they can afford.
Without having the insurance, it would be pretty hard because right now, at the point, I'm not working because when I was pregnant with him, it was such a hard pregnancy and having a C-section and all that. So he's the only one working. So having those big co-pays and having those where you have to pay the whole bill or a majority of it would be really hard, like with one person working in the household right now.
So I was born and raised in New Mexico. I'm a mother of 2, and getting my children access to healthcare has been one of the biggest stressors in my life.
The reason it's so important for kids to have coverage from prenatal is it's all about child development. We need to give kids the best start that we can.
If all our families, if all our children don't have access to the healthcare they need when we need it, I'm really concerned about the future of New Mexico.
So one of the things that I hope comes out of the discussion today is that by hearing kind of a diverse group of perspectives, that we might establish some common ground and maybe begin to think of some strategies that we can employ to improve access to health care for kids and access to coverage.
We've seen enough of what the fallout looks like of having poverty, lack of education, lack of health care. It's playing itself out every single day in the streets and in the communities of New Mexico. And we hold the key. We can make it a priority and change this, and we can do it together.